Welcome to Jaw Talk. I'm your host, Dr. Tiffany Lamberton. In this two-part podcast, I dive into a thought-provoking discussion with Hallie Bulkin. Hallie is a dynamic professional juggling roles as a business mentor, podcaster, feeding specialist, certified myofunctional therapist, and speech-language pathologist. Pretty much a rock star. Her leadership as founder and director at Little Sprout Therapy and Metro Myo enriches the landscape of pediatric practice, extending virtual, in-home, and in-school services. This episode becomes an essential listen to everyone aspiring to grasp the myofunctional therapy perspective and beyond. Our conversation really explores the paradigm shift within healthcare, navigating the complexities of early intervention, advocating passionately for comprehensive pediatric care, and Hallie's firsthand experiences with nasal airway obstruction and physical therapy. Ready to take a listen? Let's go.
Quick legal disclaimer. All information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider.
All right, Hallie, welcome to Jaw Talk. Thank you so much. I was looking back and it's been almost exactly a year since I was on your podcast, the Untethered podcast. I think it was like episode 173. So thank you so much for being on Jaw Talk today. It's such an honor to have you recording with me. Thank you. How are you?
I'm great. And I'm excited to be here. I love talking. So, put me on a podcast. Sure. Yeah. No, when you reached out and you were like, I've got a podcast and do you want to be a guest? I was like, yes, I love what you're doing. This is really exciting. Thank you for having me.
Thank you. Well, my podcast is just an itty bitty, this is like in its infancy and you're like pro, you've been doing this for almost 3 years, I think now, right? Tell everybody, who you are, what you're passionate about, how you kind of journeyed into this world of oral myofunctional therapy.
Absolutely. So Hallie Bulkin and, SLP, speech-language pathologist by trade. I fell into the myo space myself as a clinician because a colleague had shared a course that she took and said, it just was really eye-opening to her. And so I said, okay, if it's helping you with these patients that seem to be stuck in speech therapy forever, I need to know what this magic sauce is. So when I signed up, I went and I took my course and it really truly was eye-opening. And they say once your myo eyes are on, you can't unsee what you now know. And the worst places to be are shopping malls and airports because all you do is, sit there and you're just watching people walk by and you're like, oh, there's an orofacial issue there. And that one probably
Airway.
You're like, turn it off. I'm on vacation. No, but so that's really how I kind of dove into the myo space initially. But then once I was in the space, I kept hearing from colleagues, I'm more confused leaving my course than when I entered. I don't know how to apply this. I'm not sure. I know how to assess, but I don't know how to treatment plan or actually work with the patients after assessment. And then there were people who said, I don't even really know how to assess. And I don't really know what I'm looking at or what I'm doing. And so I was like, well, that's a lot of money to invest in our industry, in our licensure, SLPs, OT, even for an RDH, to invest this money and to come out after spending several $1,000s and kind of go, yeah, I'm confused. I don't know what to do next. And so that really kind of it grinds my gears a little bit. And so I had already created this online pediatric feeding course. And so I had a group of individuals where I was applying this knowledge to, SLPs and OTs doing feeding therapy with the birth to 5 crowd, the pre-myo crowd, if you will. And everyone was going, but how do we apply this information, this myo information to babies and toddlers and children who maybe are not your traditional myo patients? And so I incorporated that into my feeding course. And from there, everyone said, okay, that's great, but now we need more education. And so then I created a membership around myo and, making sure we were reviewing the research and study clubbing and getting continuing ed from all different kinds of specialists in, related areas and in the myo space. And then from there, everyone was like, okay, so when's your course coming out? And I was like, oh my gosh, I am tapped out. And it took me a year and a half after I promised it was coming. I finally launched my course. Then they begged for a certification. So I launched a certification. But, it's been a really, I think, rewarding journey because I know that the clinicians that are going through the course, the certification that are part of our membership are really, they're getting good information. I like to call it muscle informed exercises where we're not just giving you a, hey, step 1, step 2, step 3 with the patient, but we're teaching you how to be critical thinkers, how to assess, how to, get your hands on faces, in mouths, like feel the muscles, understand where the weakness lies, what is the root cause of what's going on. And then, okay, now that we know that information, we can take that back and go, okay, let's use what the muscles are telling us and inform that in making a decision as to how we treat and what that looks like. So, a whole 3.5-year thing all in a little 30-second explanation. Maybe that was 3 minutes. I don't know. But yeah, I mean, that's kind of how I felt into it. My own child, when I came back from my myo course, I realized she had a tongue tie. I realized she had an orofacial myofunctional disorder. I already knew she had a pediatric feeding disorder as well. And then my second one, when she was born, also was born with a tongue tie. Then I discovered it on myself. So I've also been the myo patient. So, my claim to fame is that I'm the clinician, the teacher, the mother, the patient, the wife, like of all things myo, TOTS, and airway.
Yeah. Well, and I think for me as well, just being a mom and like you said, like looking at your own child and you're starting to see these different things with their growth and development, both, the musculoskeletal system, but also that underlying skeleton underneath where you're like, hey, maybe their maxilla and their mandible, they're not in quite the right place. Like, how do I collaborate with other healthcare providers? So tell us how you found kind of like your orthodontist or your airway person to kind of like, see things through the eyes that you're seeing it.
Yeah. So it's actually kind of funny because a really good friend of mine from growing up, Dr. Jennifer Tipograph, before she was a doctor and married Jen Byron, we grew up together and we just kind of accidentally recrossed paths. And I was like, oh, you work at a holistic dental practice. And the other dentist that owns a practice has I think orthodontic credentials as well. And so I was like, huh. And so I kind of started to look at their website and have conversations with her and came to realize that we were on parallel pathways. Like they were doing a lot of adult expansion. They were basically seeing a lot of ties, airway issues, but taking a very holistic approach, very much so what I was learning about. And so we kind of came together and started collaborating and in many different ways. And, it's been really amazing. Obviously, it's very beneficial for the patients, but that was easier than I anticipated it happening because it did take, I've had a private practice since 2014. I started down my myo journey in 2017, and it took until this year, 2023, to find an ENT that gets it in the DC metro area that we could refer to. So I fully recognize that finding the providers and crafting your team in this space is not usually easy. I got really lucky with Jen, but the rest of the team has slowly come together over the years.
Yeah. And that's what I've heard from other providers is just how frustrating it is, whether it's like OMTs saying like, I'm going to orthodontists and they're not interested. I know in my experience too, just even being a general dentist with an interest in TMD, I'll go to orthodontist and saying like, okay, hey, their jaws aren't in the right place. We're not seeing the growth and development. We need to kind of combine both our clinical exam, but also with modern imaging, and the pushback that you get from that can sometimes be so discouraging and devastating, I think, especially for a new practitioner.
Oh yeah, definitely. And that's probably one of the biggest questions that we get amongst those who take my course or those, and I do talk about this in my course and we've talked about it inside my membership, but it comes up a lot in the membership. Like, how did you find someone who does X, or how do you even find that first person to collaborate with? And I've done some trainings and I tell people to just look up, use certain keywords, tongue tie in your area, see whose websites pop up, adult expansion, just different keywords that you may not think of, but may be pulled up on someone's website. Or, because I always used to say look up holistic providers because their minds are more open. And so even if they're not in this space, they may be more interested in getting into this space with you. Dr. Jen and I did go to a tethered oral tissue course and sat next to each other for 2 days and took that course together back in, I think that was maybe 2017. So, it's one of those things where, again, I got lucky, but finding the right person, even if they aren't in the space yet, who's open to it, I think can be a big win because, like I said, you can learn together. So it's really just kind of figuring out who is that person in your area.
Yeah. Well, and I think that we need to have kind of like this directory somehow. I've been thinking about, as TMD Collective is, kind of growing, I look at what you've done as sort of like, this is my goal. I want to do kind of like what you're doing, but also like really educating the general dentist about, pulling in those integrative things, pulling in what the PTs and the SLPs, like I was a physical therapist before I did dentistry. And, it's like when you're working with a complex neurological patient, you want to have the OT and the PT and the speech language pathologist. We all need to be like talking together, like, what are our goals? How are we going to accomplish that? And so I think like that, those types of providers are like more open to like working together. Whereas I think general dentists tend to be like, okay, this is how I've always done it. And, this is what the standard of care is. And I get that, but we also have to like have that bigger lens. It's just like the more that we discover about tethered oral tissue, the more that we understand about muscular imbalances, the more we understand about the cervical spine. We can't just look at just the teeth, right?
Yeah. Yeah. Well, and I've like co-taught at conferences with some really cool dentists in this space. And, some of them share their stories about how they were restorative. They had a big fancy restorative dentistry practice, and they realized that one of the guys says, like, I literally was killing my friends. Like now when I look back, I was actually closing up the airway, and it was and I'm not a dentist, so I don't know the terminology, but it's like they were coming in and the tooth was cracked again, or whatever they were doing, the work was not holding because airway is going to override everything else. And so while he was basically retracting the jaw, not knowing any better, he later found out, like that's not what we want to do. We want to bring the face forward and bring the jaw forward, especially during sleep. And so I think it's really interesting, even for me as a speech pathologist, to hear dentists like have these like come to realizations of like, how they even shifted not just their practices and their knowledge, but their identity in a sense. And I do think that happens for a lot of us in the speech pathology and even the OT and PT space too, because as we start to get into this, I know my brain was like, oh my gosh, like all these patients that I could have helped, I did, but like, could it have been better? Could I have done more for them? And I mean, we can't really fall into that all the time. But at the same time, you just kind of like, there was some guilt that came up for me in the beginning. So I was like, this all makes so much sense. Why is nobody talking about this? Why is nobody teaching this? Why is this not part of our grad school curriculum? Right. And I think that's also one of the reasons it kind of like pushed me to want to educate more in this space and create what I have created. But, there is still a 50-50 divide, and that's my made up number. There's no actual official data to back that up. But in the SLP world, there's people who don't believe in myo. They don't believe in myo like it's a religion. They don't believe in tongue ties like tongue ties are a religion or something. And we're like, you don't have to believe in it. It's a documented, researched modality, and tethered oral tissues. Like, this is fascia in the body. So I'm not sure what there is to believe or not believe in, but that's fine. But there's quite a big split, and like one camp against the other, even within, which is obviously not very helpful for the overall cause. So I do feel like I see it across professions.
Yeah. Well, I think even in like the TMD world too, and I mean, I kind of like just don't pay attention to a lot of the like different camps, but like there definitely are like different camps, and they all seem to kind of be like wanting to like tear each other apart. And it's like, let's just do things for the good of the patient, right? Mm-hmm. And to me, what's so exciting about like what you guys are doing is that you're able to do things interceptively in a younger and younger patient population, where instead of just like letting everything deteriorate, and then you're an adult and then you have all of these issues, like why can't we just, I call it like having almost like a crystal ball with these like very young kiddos, maybe like the 7 to 14, or even, I mean, your patient population is a little bit younger, but for me as a TMD dentist, I get a lot of women who are, kind of like 35 to 55 that have, now they're in a lot of pain. They have a lot of symptoms. They have limited range of motion. They may have locking or clicking of their joints, a lot of headaches and migraines, that we're trying to like unwind all these different systems. And it's like, what if we could prevent all of that? So to me, that's kind of like where TMD Collective was born, is like, if we could could make it better for the individual, let's make it better for the collective. And so to me, building these networks of providers that are like-minded in the passion, and, maybe we have just a slightly different lens. I mean, like, I don't know anything about swallowing, so I could go to you and be like, okay, I can't remember in my, OMT course, like, what was this and this and this, and so I think we just have to be humble and be curious and be willing to adapt to new information and new literature that's coming out, and
For sure.
the other thing is that I feel like it's so exciting. We're starting to really incorporate all of this like modern imaging technology, cone beam CT, MRI, ModJaw, looking at like movement in 4D instead of like a little articulator with like, I mean, it's hilarious.
Yeah.
You look at, my dad was a dentist, and I was like telling him like, Dad, we're doing this and this and this with like digital and, treatment planning. And he's just like, mind blown.
Yeah.
The
No,
industry
it's
is
cool.
just changing so much too, so just trying to stay on top of, all of the changes that we're seeing with AI and, with digital dentistry and digital technology, we can't be afraid of that. And I think that younger providers are not afraid of that. And so I think that if we have the opportunity to kind of intercept these young kiddos before they grow into this whole pathology, to me, that gets me like so excited.
Oh yeah. Oh yeah. Well, and that was like my whole thing too. I was like, well, and even, yes, younger patients, but then we were kind of going like, well, but if they have to have the cognitive ability of a 4-year-old to engage in like your traditional Myo program, well, we're going to make everybody else wait. Like then things like compensations are going to continue to, top each other, and we're going to have this like snowball of compensations by the time they're 4. Like, let's intervene as soon as we know there's an issue. And that's where I became like super passionate about like, okay, how do we adapt what we know and what we've learned in more of a traditional Myo sense to our little ones? And then I kind of went, this is what some of us do in feeding therapy anyways, but let's put a bigger emphasis on it. Let's make it its own goal. Let's make sure these babies are nasal breathing. Let's make sure that if they're not nasal breathing, we're looking into why. Like, is there obstruction? Is the jaw too small? Is it too far protruded? Do they have allergies? Like, what is happening that is causing this baby's airway to be impacted? Why do they sound like they're snorting? Why are they choking on feeds or gagging on feeds? Why are we seeing these various symptoms that just seem so common these days? And, to the point where like, everyone's like, oh, the baby's snoring, that's so cute. And I'm like, no, snoring is never cute. Snoring is never, ever cute. And you do not grow out of it. So if a pediatrician says that one more time, I swear to you, like, I'm just going to lose it. I'm like, no, we need to babies should come out. And I always say, I'll give a little bit of wiggle room. Yes, they need to clear. And sometimes that can take a week or two for a baby's like airway to fully clear after they've come out of mom's womb and everything, but they should still have a closed mouth position and their tongue should still be up on their palate at birth, because that's how it should have been in utero. And we developed that swallow in utero about 12 and a half weeks in. So right at the end of your first trimester. So baby's been swallowing this way for a whole 2 trimesters before being born. This is not a new issue. It's already there at birth. And, and then we see these babies who struggle to feed or have like what we call orofacial. Maybe they don't have true like reflux, but they have all the reflux symptoms without like vomiting up feeds because they're swallowing a lot of extra air because of their tongue position and the inability to cup and suction and do all the things properly, right? And they're pulling all this air in. So the baby's really unhappy and you're already not sleeping. Now you're really not sleeping. Plus you've got everybody on high alert and nobody's in rest and digest. Everybody's like in fight or flight. Mom, dad, all the caregivers, baby. So it's just, that was kind of having had a child like this myself and then having, a second one where we intervened on day 5 with her tongue tie release and other interventions surrounding that. It was 2 different experiences. And I was like, we've got to provide this to others. I see the difference in what happens when you can provide it as soon as it's recognized and when you're educated in this area to know that it exists as a problem versus on the back end, I didn't find out that my other daughter had a tie until she was 24 months old. And even then, trying to get somebody to address it, like I was turned away by 2 ENTs that were supposed to be in the tongue tie space. And one because I wasn't breastfeeding and the other one because she was sitting there with her mouth closed during the 5 minutes that the ENT sat with us. And I was like, cool. She's always sick. She's got touching tonsils, but that's fine. She's fine. cool. No medicine, no follow-up, no check back in 3 months, nothing. Sent us on our merry way. And this is a person who supposedly had taken like a myo course too. And I was like, you got to be kidding. Like, where do we go now? And so I just was like, I got to take it into my own hands. I don't know what that looks like yet, but here we go. Mm-hmm. So yeah, we need to be intervening a lot earlier. And I do feel like there is a responsibility that should fall on like, whoever's working in the hospital and also pediatricians to be screening for mouth breathing versus nasal breathing. And if mom says there's a feeding issue, you better be supplying mom with resources like today, not next week, not 6 months from now, and baby's headed towards a feeding tube or, has been struggling to stay on the weight charts, because the weight tends to be one of the main things that they look at. And that's one of the it's one of the important factors, but like one of like 25 symptoms that is usually present. So another thing that kind of grinds my gears a little bit is wait until baby's like, off the weight charts. But anywho, I digress.
Yeah. Well, and I mean, another thing that I, kind of is frustrating to me too, is when you have that older kiddo, like I said, maybe they're like 5 or 6 and they're displaying signs of sleep disordered breathing, maybe, again, snoring, mouth is open when you're videoing them at night. Maybe they're wetting the bed, still wearing pull-ups, they're, progressing. And, I think for me as a mom, I, was just like, again, relentlessly advocating, what does the literature say? Okay, we've done tonsils and adenoids. Now what? What else can we do? And again, I think that as moms, we've got to advocate for our kiddos and, for our patients. We've got to, as healthcare providers, really kind of like going back to the building the collaborative team, is find those experts and like, let's all be kind of like adding our piece to the puzzle, because, I think that a lot of parents, that maybe they're seeing kiddos with behavioral issues, maybe like ADHD or like difficulty in school, where it was just like, oh, let's kick the can down the road. Let's wait. And then they're in school and now it's a problem, right?
Yeah. Oh yeah. I mean, I was also this kid that never got picked up on. And at age 5, it was like, oh, hey, maybe we should take Hallie for some evaluations. And my mom spoke, I think she had several conversations with different psychologists, and one basically tried to diagnose me without ever meeting me over the phone. The other one, she's like, each one had like their own thing. And at the end, the last one we spoke to said, you know what, like maybe your child just needs more activity. Maybe your child like needs to be allowed the opportunity to just be herself, didn't want to medicate me. And my mom didn't want to medicate me either at 5, which I'm thankful for. And I did okay. I was always the kid who got S's on report cards for satisfactory because I talked too much. Now I have a podcast. Served me well. But, it's one of those things too that like I struggled when I got to college, because I kind of like coasted throughout school and figured it out myself. And then I got to college and I just like everyone was using my notes, not going to class, and was getting A's on, the business courses. And I was using my notes and did go to class and got like a C on my first test as a freshman in my business class. And I mean, if I tell you my life was over, because I was so hard on myself, like it wasn't my parents, it was me. And I was like, I've always been an A/B student. I've never gotten a C in my life. Like, what is this? And, I got tested, they put me on medication, but now even looking back, I'm like, well, it's because I had an airway issue. It's because even though I had expansion and orthodontia, my teeth were made to be straight and pretty, not functionally opening my airway. My, jaw needed forward growth. My jaw needed more, expansion. So yeah, it's these kids, we get kids on the caseload sometimes in my practice who are 5 years old. They're on a stimulant, they're on an antidepressant, and they're on like some kind of a downer. Like they come in on 3 medications, and it breaks my heart because that I'm like, have they had a sleep study? No. Who in their right mind is putting this child on 3 medications at age 5 and you've never looked at their airway?
Yeah.
Like make it make sense.
Yeah. Well, talk a little bit about I was listening to an episode that you did recently where you talked about, the surgery with your nose and just, what a difference that was, kind of like nasal pharyngeal airway versus oral pharyngeal airway. Tell us a little bit about that journey.
Yeah, absolutely. So, I mean, our oropharynx, I would assume that most people listening to this probably know, like it lies between our soft palate and our hyoid bone. And for me, like that was not so much the issue. My oropharynx like appeared okay. It wasn't the smallest thing because I've had plenty of CBCTs and everything. What my issue was more like the nasopharynx, and you couldn't really tell because the front portion of my nose looked pretty straight, but the back like third of my septum was really deviated to the left side and apparently was blocking like my entire like left nares and, you know, that part of the cavity. I also had enlarged turbinates. I had enlarged nasal swell bodies, which I had never heard of before being diagnosed with it. And the ENT that I saw was phenomenal. They sent me down the hall to do a CBCT. I came back. Her physician assistant had taken my whole history. She had like the results of the CBCT up on the screen. The ENT comes in, she runs me through everything, gives me all my different options. And I was like, okay, well, obviously I want to breathe. This is great. Like, cause she talked about open procedure versus closed procedure. And I was like, closed seems really good, except if I want a rhinoplasty, throw it all in because I'm going to be under, like, what's that look like? She's like, well, that's definitely an open procedure, but I love rhinoplasties. Let's talk. And this ENT is double board certified as an ENT and a plastic facial surgeon. So I fully trusted her to do this on my face. But I can't tell you like how different I feel now. And you know, I had done a sleep study just for my own knowledge, just for fun beforehand, before I ever even went to see her. I said to her, like, I'm doing one with a colleague who knows how to read like the raw data in the way that I'm interested in understanding. You know, they're going to send it to beam readers, but then he'll also kind of do further interpretation. And what we did see was that I was never going into REM sleep, or as soon as I went into REM sleep, my body jolted me right out of REM sleep. And so I didn't present like your typical obstructive sleep apnea case or any type of sleep disordered breathing, you know, on the general scales. What I do present as, which is still not well known, is having UARS, upper airway resistance syndrome, right? And so that's becoming so common, especially in like fit females and yeah. And, you know, and before a couple of years ago, I'd never heard of it. It's so new, but it was crazy to me that my airway could be so impacted and a traditional sleep study would not be picking up on that or would not recognize it as me as having an issue, because I'm no joke. Like I felt like I was constantly feeding myself like caffeine and other things to just get through the day. And like, I'm a pretty high energy person, but like when I zonk out at the end of the day, like I'm done. There was no more energy for like anything else at the end of the day. And now after the fact, now being about a year and 3 months, almost a year and 4 months out from the procedure, being able to breathe through both sides of my nose, being able to sleep all night and actually get like restful sleep, wake up in the morning and feel rested. I'm like, I didn't know what I was missing out on, because I don't think I've ever felt this before. Like I think my entire life, even before my septum was deviated, there were other airway issues that probably was impacting my sleep. Like I was a high energy kid. Like I was a kind of kid who was not like, I would say mean things to my parents, but I don't think that's who I was personality wise. I think that's where I was like energy wise and what I could handle was like, you're asking me to do something that I can't do. So you're just mean and I don't want to be around you, you know? And that's, unfortunately, it shaped part of my childhood, right? And that shaped who I became at a certain point. But looking back now, I mean, I had a very good childhood and, you know, happy, healthy, wonderful parents. But it makes me wonder, like, what would have been different? Like, what would my college experience have been like had I actually been able to breathe and sleep and retain this information differently? I did learn other strategies for like how to study. And I did jump from like, I think I got a 2.4 my first semester in college. And I was partying, but I was studying and I was actually going to class, to a 3.8 and then a 4.0 like every semester thereafter through the end of grad school, because I taught myself new strategies, but they were compensatory, because I still had a messed up airway. And so now that I, you know, can breathe and can function better, I'm able to get through things a lot quicker. Mm-hmm. And, you know, there's still things that are like, I still definitely consider myself neurodivergent. I definitely have ADHD. Okay. There's no doubt about that. It's definitely done something to my brain, not being able to breathe for 37 years of my life. But, you know, I feel like on the flip side, it's also given me perspective and going through this experience to really actually understand and have conversations with patients and with other providers to basically say, hey, nobody really knows what they're missing out on until they experience what they've missed out on. And you can tell somebody all day long. I used to tell people. And now that I've actually gone through that experience, I'm like, it's a whole different ballgame.
Yeah. Could you also share? I know that when you did some expansion, you also worked with a wonderful physical therapist from PRI. Tell us a little bit about the body work that you had done and what that was like.
Absolutely. So the physical therapist who is PRI trained, he does what he calls modern counter strain technique. He says it's not the same like counter strain that a lot of people know about. And he's done a whole lot of like other trainings too, and is creating a whole thing with Brian Tuckey. The two of them are pretty genius with like their hands. But when I would go to him, I actually started with him before expansion because I was referring some patients, and I always like to go and try out the providers and know who I'm referring to. And I did some sessions with him because I was always told that like one leg was shorter than the other, and a chiropractor at some point told me, no, your hips are just like misaligned right now, but like let's realign them. Look, your legs are the same length, right? So I kind of knew there was like some stuff within my body, but I think that all tied into my tongue tie and my other tethered, the oral tissues and just the tension patterns I've been carrying for so many years. And so I was seeing him a bit before I had my second daughter, because I also know I was very like tight up in my upper body and my like thoracic area and clavicular area. And so he really helped me to kind of like breathe properly and stop all the clavicular breathing that I was doing. And that was really helpful. That really helped me in that second pregnancy. But then afterwards, I went back to him when I did my appliance and surrounding my tongue tie release and everything. And he, I don't know how to explain it other than I feel like he barely touched my body, but I leave feeling like I had a full body massage. And you could feel things flowing. Like he said, not everybody can feel it. There's a small percentage of the population who can, but like he would do something and he'd be like, do you feel that? And I'll be like, yeah. Like I feel like the fluids or the blood or something's pumping again, flowing. And he's like, well, it was kind of like restricted or kind of blocked up, or, it's like, he kind of refers to it as like you're unlocking your body. And halfway through my expansion process with my appliance that I was using, I noticed I couldn't crank it anymore until I saw him. And I would literally be in his office. He would work on me. We would crank it right there, put the appliance in. And I'm like, oh, it goes in, because my maxilla was so locked up that like I could not, it just wasn't happening without some other form of intervention. I'm about a year in, and I wore my appliance for 2 years. I still have like my maxilla is turned inward on the left side, and it's definitely off center. And he was the first person to look at my facial, appearance, like profile and everything, and go, hey, you know what? Your jaw's not off. Your jaw's actually in the right position. Your mandible, your maxilla, your upper jaw is the problem. And I was like, nobody's actually ever said that to me before. I was like, okay, well, this is so fascinating. And it's something I'm still like needing to continue to address now that I've had the nasal surgery. I almost wish that the nasal surgery had happened first before the expansion, but live and learn. So yeah, so that's where we're at.
And there you have it, part 1 of Hallie's episode. Thanks for listening to Jaw Talk. I know you're excited to hear my thoughts about Hallie's personal experience with physical therapy, so stay tuned because that's going to be in part 2. If you're finding value in this content, I would really appreciate a review on whatever podcast platform you're listening, or if you're watching this episode on YouTube, please subscribe to my channel. Your support really means the world to me as I continue to grow this podcast and bring valuable content to all of our dedicated professionals like yourself. Stay tuned for upcoming part 2 of Hallie's episode. Our conversation was so enjoyable, I couldn't bear to cut out any of the valuable insights. Rest assured, I'm dedicated to sharing her wisdom with all of you. Until next time, stay humble and stay curious.